Hello everyone. Today I'll take you through the steps of chin implant procedure for a 23-year-old young girl concerned about her retruded chin. She feels that affecting the appearance of her profile. So join me and have a look at the various steps of the chin implant procedure. Today I'll take you through the steps of chin implant procedure. This procedure is done for someone who is not happy with their chin because it's retruded or it's small, and they have taken non-surgical procedures like fillers and have seen the enhancement and are happy with it. I recommend all my patients to go through non-surgical chin enhancement before they decide upon getting a permanent procedure, simply because they would see how the enhancement would look like, and if they're happy, it is better to go in for a permanent procedure. We use silicone implants. We measure the size pre-operatively to match the contour of their jaw, and based on that we choose the implant. And it's a short procedure. It's done under IV sedation, that is intravenous sedation with local anesthesia, or sometimes a short general anesthesia if the patient is not able to tolerate the intravenous anesthesia. So come along and join me in watching the steps of chin implant procedure. Today I'm going to do a chin implant for a 23-year-old young girl who's taken fillers before. She's always been concerned about her retruded chin. She feels that affecting the appearance of her profile, and then she's happy. She's taken fillers and she's happy, and now she has opted to go in for a chin implant. So first I'll just give a little bit of local anesthesia just to reduce bleeding here. That's the chin that you're seeing here. You can see the white bone, that's the chin. You can see the border. Right, so we'll just place the implant now, right? So I normally pre-mark, pre-measure, and then look at various sizes and decide on the size. And patient is monitored in the hospital for about 4 hours till the recovery is complete, and then sent home. Patient is advised to wear a tight compression garment for a period of 2 weeks at the least, so that the implant is nicely settled in the place it is put. It's a very simple procedure, gives a very satisfying results for the patient.
Audio Jungle.
So some of the common complications we can come across are one is swelling after surgery. Also, patient can experience some pain following surgery. The other complication is a patient can experience what we call seroma, that is collection of fluid following surgery. Also, if there is a lot of bleeding during surgery and the bleeding has not been stopped, a patient can present with collection of blood in the surgical area called hematoma. Another complication can be following chin augmentation. When the incision is made just below the chin, you can also get a small scar. Following chin augmentation using an implant, the implant can also be mobile and it can get dislodged if the surgeon is not securing the implant to the jaw or the pocket is made too big. Patients also can complain of contour deformity following the surgery, when this can be due to choosing the wrong size of implant in the patient, or when the implant is not placed in the correct area of the jaw. There is also a possibility of capsular contracture. As the implant is a foreign body, it is a normal reaction of the human body to form a capsule around this implant, and this can lead to capsular contracture after a few months. There is also a very small chance of your mental nerve being injured during surgery. It can be temporarily affected when the nerve is stretched, and this can lead to temporary loss of sensation in the lower lip and chin areas. So we have discussed most of the complications of genioplasty. Most of these complications are very rare and they can be avoided if we take proper precautions during surgery and also after the surgery during the post-op recovery period.